Breast cancer is a significant health concern. Each year in the United States, about 240,000 cases are diagnosed in women alone. Mammography has been instrumental in the early treatment of breast cancer, and these days, a surge of innovative technology is allowing for better results. Bridget is standing by to discuss more in today's Ask a Doctor.
Ask a Doctor is sponsored by Red Mountain Weight Loss.
What was widely once seen as a death sentence is now being seen as treatable and curable in many cases thanks to advances in medical technology. Joining us now, Dr. Mustafa Amani, breast surgeon from Health First, and we appreciate you being with us today.
Thank you very much for having me.
When we look at the screenings that are available right now, you're saying that we're just in one of the best places right now in technology in terms of early detection. Why is that?
Absolutely. So basically, screening first and foremost is paramount to get started on time and to speak with your medical provider that you start on time, and that's usually at age 40. But as far as the technology is concerned, nowadays we have much more sensitive mammography equipment, as well as the adjunct treatments that we have as far as ultrasound and MRI capabilities as well.
So what can you expect when you go in for, say, your first mammography? What will that, your first mammogram rather, what will that look like? Is it a different type of machine, or like you said, different resolution? Is the procedure any different?
No, so obviously the procedures are going to be a little bit foreign to you because this is your first time, but there will be practitioners there and nurses there to guide you. Basically the mammography the first time is to get a baseline exam, unless you have some sort of personal history. And then that's where you have a conversation with your medical provider that, listen, I have something else going on. I either have personal history or family history. Maybe I need to start before age 40. And that's a discussion that you generally have with your provider. And
so when we talk about family history, personal history, when we say family history, does this mean breast cancer on either mother or father's side? How does that, what quantifies family history?
Absolutely. So basically close family relatives, right? So either mother or father's side. And then it also depends on the age. So generally we say, you know, at age 40, but if you have someone that has had breast cancer, a close family relative, at a certain age, then you would essentially qualify for getting screening earlier than age 40. And that's where the conversation with your medical provider comes in.
Now then, differentiating to personal history, let's say, you know, as a black woman, I may have a denser tissue than, say, someone else, but then other ethnicities may also, maybe your personal chemistry or your body has denser tissue. So is that, would that qualify as personal history because that tissue may be more prone to show up like possibly a lump?
Absolutely. So you bring up a very good point as far as breast density is concerned. So that is very, very important to keep in mind. Breast density, mammography in general is great. It's a great screening tool. Sometimes breast density, especially extremely dense breasts, can have, or you can have a tougher time kind of getting a complete evaluation with mammography alone. Again, this is where the conversation with your medical provider comes in. With doing adjuncts like an ultrasound or an MRI if you have a certain breast density or a certain history. So it kind of like you said as well.
Okay. And so if it comes down to it, this detection being earlier because of the technology, so is that we're finding it in like a stage 1 versus maybe not catching it until 2 or 3 or 4, or how would you quantify that?
Absolutely. So early detection is key, and you alluded to it, right? So basically our goal is to catch breast cancer as early as possible, obviously stage 1 before it progresses.
You can even be a stage 0, right?
You can be a stage 0. So stage 0 is a special type of carcinoma. That's ductal carcinoma in situ specifically, but yes, but you could be stage 0. But we want to catch it as early as possible. Treatments and treatment algorithms are significantly impacted by how early we catch the breast cancer, both from a surgical standpoint as well as the medical standpoint, you know, systemic therapies and such.
All right, great information, Dr. Amani. Thank you.
Thank you.
Get in there, ladies and gentlemen. Get screened if you think that you need to get in there. You should do it. Let's get over to Julie.